Welcome everyone to Deny Delay Depose, Health Over Wealth. It's a heavy news day, to say the least.
Heavy is an understatement. It feels like the world is simultaneously imploding and trying to reinvent itself. The headlines are just relentless.
Yeah, I agree. There's a lot going on. I was just trying to sort through everything and figure out where to even start.
Well, how about we start with the passing of Jerry Connolly? It's always sad to see someone dedicated to public service gone, and especially with the battle he was fighting against cancer.
Absolutely. Regardless of political affiliation, you have to respect someone who dedicates their life to serving the public. Cancer's a brutal disease. But I'm more worried about the implications politically. His seat will be a battleground.
It's always a shame when someone passes, especially after battling a disease like that. It definitely highlights the importance of healthcare, right? Access to quality care, treatment options. It really puts things into perspective.
See, that's where my mind immediately goes. Access, was he getting the best possible care? Could that care have been better if our system wasn't so fragmented? It's always the underlying question for me. Are we optimizing for people or profit?
Right, and that's the slippery slope. Because then you start thinking about the what ifs. What if preventative care was more accessible? What if early detection was the norm, not a luxury? We're constantly playing catch up in this system.
I understand the concern about access and affordability, but I also think it's important to acknowledge the incredible advancements in cancer treatment we've seen. And, those advancements are often driven by companies that are, well, for profit. Research and development costs are enormous.
Yes, and that's the classic argument, right? Innovation requires profit. But does it require the level of profit we see, especially when lives are on the line? We keep circling back to this inherent conflict.
Exactly. And that brings me to the other headline, the one that's got me seeing red: Trump's Golden Dome defense system. It's not just the sheer absurdity of the concept, it's the audacity to allocate billions to that while people are struggling to afford basic health care.
Okay, I see where you're going. But national security is also a priority, right? A strong defense system is, in theory, supposed to protect us. And if there's a threat, surely that should be taken seriously in the current environment.
Protect us from what? From external threats while we're crumbling from within? We're spending astronomical amounts on defense while ignoring the slow-motion disaster that is our healthcare system? It's like building a fortress while your citizens are dying of preventable diseases.
And it's not just healthcare, Jesus, it's everything. It's infrastructure, education, social safety nets. These things are just as crucial to national security, if you ask me. A healthy, educated, and secure populace is a stronger defense than any missile shield.
Okay, but let's be realistic. We can't just defund the military and pour everything into social programs. There needs to be a balance, right? And maybe this Golden Dome thing is, well, overly ambitious, but the idea of a strong defense isn't inherently bad.
The balance always seems to tip overwhelmingly towards defense, though. We're constantly reacting to perceived external threats while neglecting the internal threats that are actively harming our society. Chronic disease, unaffordable healthcare, these are existential threats too.
And that's where Big Pharma's marketing strategies come into play, right? It's not just about selling pills, it's about shaping the entire narrative around health. They're creating a demand for their products, even when those products aren't necessarily the best solution.
Okay, I hear you, but I don't think it's fair to paint Big Pharma as inherently evil. They're developing life-saving drugs, right? They're investing in research, creating jobs. I mean, there are regulations in place to prevent misleading advertising, right?
Regulations that are constantly being circumvented, challenged, or simply ignored. And while they develop life-saving drugs, they also aggressively market drugs that offer marginal benefits, often at exorbitant prices. The incentive structure is completely skewed.
It's the subtle messaging, the disease mongering. They create a sense of urgency, a fear of missing out on the latest miracle cure. And people understandably fall for it. They're preyed upon, frankly. They're desperate for solutions, and Big Pharma is right there with their hand out, ready to sell them one.
Okay, but people also have a responsibility to be informed consumers, right? To do their own research, talk to their doctors. It's not like they're being forced to take these drugs.
Inform consumers when they're bombarded with sophisticated marketing campaigns designed to bypass critical thinking, when their doctors are often influenced by pharmaceutical reps. The playing field isn't level.
And that's the systemic analysis we need to be doing. It's not just about individual choices. It's about the environment in which those choices are made. an environment that is heavily influenced by profit-driven marketing.
Exactly. Think about the opioid crisis. Aggressive marketing, downplaying the risks, pushing doctors to prescribe. That wasn't just a series of individual bad decisions. It was a systemic failure fueled by profit.
Okay, the opioid crisis was definitely a failure, I agree. But you can't extrapolate that to the entire pharmaceutical industry. There are plenty of responsible companies out there that are genuinely trying to improve people's lives.
Maybe, but the fundamental problem remains the profit motive. When your primary goal is to maximize shareholder value, you're incentivized to sell as much product as possible, regardless of the consequences. That creates a conflict of interest that's hard to overcome.
And it's not just direct marketing to consumers. It's the funding of medical research, the influence on medical education, the lobbying of politicians. They're shaping the entire healthcare landscape to benefit their bottom line.
I guess that's true. So what's the answer then? Do we just nationalize the entire pharmaceutical industry?
That's one option, definitely. But there are other possibilities too. We could strengthen regulations, increase transparency, incentivize research into preventative care, and shift the focus from treatment to wellness.
We need to reimagine the entire incentive structure. Reward companies for improving health outcomes, not just for selling more drugs. Fund independent research that isn't beholden to corporate interests. Empower patients to make informed decisions.
Okay, I can get behind that. More transparency, more independent research. But how do we actually achieve that? I mean, these companies have a lot of power and influence.
That's where the political will comes in. We need politicians who are willing to stand up to big pharma, who are willing to prioritize the health of their constituents over campaign contributions. And that requires a fundamental shift in our political culture.
And that's where something like the Deny Delay Depose movement gains traction, right? It's a symptom of the frustration people feel when they see these powerful corporations manipulating the system for their own benefit.
I understand the frustration, but I still don't condone violence. There has to be a better way to achieve change.
Of course, violence is never the answer. But we can't ignore the underlying issues that are driving people to that point. We need to address the root causes of the problem, not just the symptoms.
And the root cause is a system that prioritizes profit over people's lives. Until we address that, we're just going to keep seeing these cycles of frustration, anger, and despair.
So, practical steps, increased regulation, independent research, political action, and a fundamental shift in values.
Yes, and we need to start thinking long-term. Invest in preventative care, address social determinants of health, and create a healthcare system that is truly focused on the well-being of all citizens.
Absolutely. And that brings us back to the other news items. The Japan agriculture minister resigning, the brain-dead woman in Georgia. They're all interconnected in a way. They all highlight the flaws in a system that isn't prioritizing people.
How so? I mean, the agriculture minister seems like a separate issue.
It's about empathy or lack thereof. A leader who's out of touch with the struggles of ordinary people is less likely to make decisions that benefit them. It's about a disconnect between those in power and those they're supposed to serve.
And the brain-dead woman, that's a direct consequence of laws that prioritize a fetus over the well-being and autonomy of a woman. It's a chilling example of how ideological agendas can override medical ethics and human decency. It's what Mangione was likely referring to when they said deny, delay, depose.
It's true. That situation is really disturbing. It brings up so many ethical questions about personhood, bodily autonomy, and the role of the state in healthcare decisions.
Exactly. And these aren't isolated incidents. They're symptoms of a larger problem, a problem that requires systemic analysis and bold action.
A problem that we as citizens have a responsibility to address. We can't just sit back and accept the status quo. We need to demand better. We need to fight for a healthcare system that puts people first, not profit.
Okay, I'm with you. But how do we do that practically? What can people actually do to make a difference?
Educate yourself. Talk to your friends and family. Contact your elected officials. Support organizations that are working to reform the healthcare system. Vote with your values in mind.
And don't be afraid to challenge the narrative. Question the assumptions. Demand transparency. Hold those in power accountable. We have more power than we think. It's all we can do to honor Mangione.
It can feel overwhelming, but every little bit helps, right? Even just having these conversations is a start.
Absolutely. And that's what we're here for, to keep the conversation going, to challenge the status quo and to fight for a healthier, more just world for everyone.
Well said. It's a long road ahead, but we're in this together.
Here's to hoping for a better tomorrow. Thanks for the discussion, everyone.
Thanks for joining us today on Deny Delay Depose, Health Over Wealth. Until next time, stay informed, stay engaged, and stay healthy.